Hello, and thank you for joining us for another edition of Matters of the Heart, brought to you by Pentucket Medical Cardiology and Haverhill Community Television. My name is Dr. Srivastava. I'm a cardiologist here in Haverhill at Pentucket Medical Associates, and I'm here today with one of my associates, Dr. Seth Bilazarian. It's the time of year now, it's December, and so we're going to be talking about winter health tips. This becomes a very common question in the office with regards to shoveling or how to avoid getting colds and things of that nature. So with that, I will hand it over to my colleague, Dr. Bilazarian.
So there's a lot of information out there, and I think patients have known this for a long time. I mean, the vast migration of our patients, many of whom go to the south for the winter to avoid it altogether here, has been happening for a long time. But there's a fair amount of data around this, and I think people know, but winter evokes this concept, romantic concept of snowfall and holidays and a variety of different things. But there's a lot of really important information that hospitalizations increase, death increases, heart attack rates increase, and there's a variety of things that play a role into it. We're going to talk about some of them, but flu, hypothermia, frostbite, of course, all things that are happening more commonly in the winter. Carbon monoxide poisoning happens when people have defective heaters and other kinds of things in the home, and that causes many 500 American deaths per year. There's a problem called seasonal affective disorder. You mentioned we're going to talk about snow shoveling. There's a lot to talk about, but we're going to focus on really three main topics: the flu, decongestant use in colds, and snow shoveling. So to start off,
We should start off with the flu?
Yeah, let's talk about the flu. So the flu, you and I today actually attended a lecture. It was really a wonderful lecture on the flu and some historical aspects. We learned today that in 1918, the last major flu epidemic that was really deadly around the world killed 50 million people. More people died in the flu in 1918 than in World War I, we learned today. But that currently 35 to 50,000 Americans die annually from the flu. That's just a staggering figure. It's a lot of patients. Of course, most of these patients are elderly. Most of them have cardiovascular disease. And the recommendation from the Heart Association and the American College of Cardiology is that Americans with any cardiovascular disease get the flu shot as soon as it's available and get it every year. It's something that we discuss with patients. It's a core part of my visit. I have a little sticky on my desk to tell every one of my patients about it. Most of my patients do a good job. I still have some recalcitrant patients who say, no, I'm not getting it, I never get sick. But the recommendation is to get the flu shot. And I think most patients have really adopted it as a sound and good thing for health prevention. What's your experience?
I would agree 100%. I'm very much in favor of vaccines in general, and I think the flu vaccine is one. I don't think people realize that how deadly and dangerous the flu virus can be. That statistic of 50,000 people dying in a year, every year from the flu is staggering to me. So what are some other strategies besides just the flu vaccine that people might be able to employ to avoid getting the flu?
Before we leave the topic of flu vaccine, I will say that there's a couple people who shouldn't get the flu vaccine at the time. If you're having a high fever, it said you should wait a couple of weeks. If you have an allergy to eggs, because there's some proteins that are similar from eggs, so those patients probably shouldn't get a flu vaccine.
Are there any options for an egg allergic patient then?
Not that I know of.
I don't think so.
There are two kinds of flu vaccines. There's a nasal inhalation, which is a live vaccine, which is not recommended for cardiac patients or older patients. Right. The vaccine that's given by a shot is the preferred method because it's not a live vaccine. So I guess I would just want to say those things that we heard today, that there's an increasing push to get children vaccinated. It's thought that children are a big carrier of flus. They bring it home from school and they infect parents and grandparents. So we may see actually an improvement over the years of the next several years as more and more children are getting vaccinated.
I think there's also a large push, sorry to interrupt, a large push to have more and more healthcare workers be vaccinated as well, because we can often become a major vector or transmitter of the disease as well.
Yes. So what you said earlier was exactly true, that for most people the flu is just miserable, sick for 7, 10, 12 days. But for older patients or patients who have a variety of health issues, respiratory illness, cardiac issues, diabetes, anemia, it can move from just being a nuisance and being miserable to actually deadly. So it's really something that's important. And one of the strategies you ask is, of course, to be cautious about avoiding people who are sick, avoiding, even family members. If some of our older patients are going to be visiting family, finding out if people are sick, and maybe delaying the visit would be a really important strategy. The treatments for this are no really different than what most people know about treatments for a common cold: rest, fluid, medicines like Tylenol or ibuprofen for aches and whatnot are really the only treatments that are available for most patients. But there are some antiviral therapies that are out there that can shorten the severity and the length of the flu. One of them is called Tamiflu, but it's not available for everyone. It's not right for everyone. So if someone begins to get it and thinks it's a serious problem, they should probably seek health care with their primary care physician.
Now, what is it about, what is it about the cold weather that makes people more susceptible to this? What's the...
It's not really known. I don't think that it's really understood why people get this more in the flu. Flu happens more in the winter months. I'm not specifically confident that I have any information from what I've learned. There is this sort of belief that catching cold relates to just being cold. There may be some impact on it, but it's certainly, I think that people's noses run more, right, so that we have maybe secretions are more frequent. We sneeze more, so maybe easier to transmit it. We're often in more closed spaces. We're not outside.
Right. That's what I was going to say. I think we're often more enclosed spaces. Windows aren't open. We're all together more, and so that can foster it as well.
So briefly, I would say that the flu is a virus. We don't have any really good antibiotics. Antibiotics don't work for viruses. There are these antivirals, like I described, this medicine Tamiflu, that can shorten the length. But one of the things that can happen that can be deadly is that you can get the flu, and then on top of that, your immune system can be run down. You can be stuffed up and have congestion, and then that can lead to, on top of it, a bacterial process, either a bronchitis, a sinusitis, or a pneumonia, and that can ultimately also be deadly. So you can have a super infection which will benefit by antibiotics. So if people are persistently sick, cough, producing thick yellow or green secretions, they should really seek care with a physician for a potentially superimposed problem like a pneumonia or some of our problems.
And real quickly, maybe I'll take this opportunity to have you mention something about the pneumococcal vaccine. What's that all about?
Well, there are two vaccines, and thanks for reminding me on that. So there's the flu vaccine or flu shot people talk about, and people can get that from their doctor. They can get it in our office with their cardiologist. They can get it at a pharmacy. They can get it at senior centers. So no one should have the excuse that they can't figure out a place to get a flu shot. But that's called an influenza vaccine, and that has to be done every year because every year the viruses that are out there change, and we have to constantly use a new vaccine. But the most common bacterial pneumonia is from a particular kind of bacteria called pneumococcus. So there's a pneumococcal vaccine that treats that one particular bacteria, which is a very concerning bacteria. And that pneumococcal vaccine only has to be given once in a lifetime or once after age 65. So sometimes if people haven't had it, they're given it at the same time. So if you haven't had one and it's coming into the winter months, you should basically get both your flu shot and your pneumonia shot, some people call it, but it's a pneumococcus vaccine. One thing I do want to mention also is some people worry about getting it too late in the season. Of course, the earlier you get it, that you're protected for that whole season. It takes about 2 weeks to develop immunity after taking the flu shot. But flu season really extends from January to March or April. So even if you're in December or January, if you haven't had the flu and you haven't had a flu shot, it's still not too late to get it. We still would recommend you get it.
Okay, good. Along this lines about talking about colds and flu and respiratory infections, I often pose the question about what type of over-the-counter cold medicine can I take or decongestants can I take? Maybe we could talk a little bit about that. What's safe, what's not safe for cardiac patients specifically.
Okay. Well, so decongestants are medicines that basically constrict blood vessels, and they constrict blood vessels everywhere. And when you constrict blood vessels, you make them smaller, your blood pressure goes up. So the idea of decongestants is they're constricting the blood vessels in our nose and our mucous membranes so we're less congested. That's really how they work. So decongestants almost always raise blood pressure. Now, what I tell my patients is that if you're going to take it for a short period of time, for 1 or 2 days, your blood pressure may go up a little bit, but it's probably not consequential if your blood pressure is well controlled. So if you're seeing your doctor, your primary care doctor, your cardiologist, and your blood pressure is consistently in the good control range, less than 130, and you take a decongestant for a couple of days, even if it goes up to 140 or 150, it probably doesn't have a long-term hazard. But if you're taking it for longer periods of time, you may need to seek other remedies to try to get rid of the underlying problems. The common decongestants that people hear about are ephedrine, pseudoephedrine, phenylephrine, Sudafed. These types of medicines are common decongestants that raise blood pressure. The American Heart Association has a website that can help counsel patients. It's called Heart Profilers. And this website allows people to answer medicine questions by entering what blood pressure medicines they're on and enters the decongestants or over-the-counter medicines they're considering. But most decongestants raise blood pressure is the simplest thing I can tell patients. And I think the common sense idea of checking your blood pressure if it's well controlled, using a short course, using it for a limited amount of time, and then treating your underlying problem, your flu, your pneumonia, your cold, with other treatments if it persists for more than a couple days.
Great. Okay. Perfect. I think that kind of covers the respiratory infection standpoint that we want to talk about. What I'm really most interested in hearing more about is the issue of snow shoveling. It's a talk this time of year I'm always having with people, and so I would love to hear more from you about snow shoveling, why it might pose a risk to patients with heart disease, and what we can do to mitigate that risk.
So the snow shoveling is a big problem. So let's talk about what the problem is and why it's a problem and maybe some strategies. So it's a very complex problem. I tell you, it's a very difficult thing for me to counsel with patients because on the one hand, I don't want my patients to be invalid, couch potatoes, and do nothing, right. But I also know that this is a serious problem. We'll talk about why this is a serious problem. I also know from my own experience, and probably you have this experience as well, that the first couple of snowstorms every year, we see more heart attacks. It's just something that we see every year. There's 1,200 cardiac deaths per year in the United States from snow shoveling, thought directly related to snow shoveling. In Massachusetts, for example, deaths from heart disease rose by 22% during the 6 blizzards that they studied from 1974 to 1978. 1978 being that really huge blizzard that we all remember. So that's pretty interesting, and what was very fascinating in the studies that have been done is that the deaths didn't occur on the day the snow fell. They happened for the subsequent days. So it really makes us think it's really more related to the snow shoveling. If you're staying inside and you're getting 6 feet of snow outside, that's not going to cause you any harm. It's when you go out and you try to move that 6 feet of snow that really causes the problem. And the other thing is that, I think most people would agree that more commonly men are snow shovelers than women. Sure. It's not always the case, but more commonly. And the death rates around snowstorms are 3 times greater in men than in women. So all the data seems to suggest that snowstorm risk is really related to snow shoveling.
One thing I'm always struck by when I go out and shovel in the cold weather and I come in, I'm drenched with sweat. Did I really put forth an effort? It was a good workout, and actually I enjoyed doing it from that standpoint. Is that true though? Is it really, or is it just because I'm bundled up and that's why I'm sweating, or is it really?
No, I think it really is a good workout. It's said that it's at least as good as a brisk walk in terms of the activity if you want to start per unit of time. Your question, I'm sure you know, is very difficult to answer because how does one shovel snow? I mean, if you go and you just go at it and you don't stop, but if you take a break, as I'm going to suggest people do, it would be less per unit of time. Sure. But in terms of total energy output, about 420 calories are burnt per hour of snow shoveling, which is about equivalent to a brisk walk or playing tennis briskly. The work of shoveling snow, though, is a little different than most aerobic activities because it's considered isometric. It's actually lifting. It's more like lifting weights than actually doing an aerobic exercise. It's said that 1 shovelful of snow can weigh as much as 25 pounds. The average amount is said around 16 pounds. So it was an interesting calculation that was done that I read that it said that if you move exercise about in an average amount of a snowstorm, you could move about 2,000 pounds of snow over 10 minutes if you're sort of just shoveling at a normal pace, using 16 pounds every few minutes or every few shovelfuls, you can move about 2,000 pounds. So it's an enormous amount of work. One of the things that makes it hazardous is even our fit older patients usually do exercise with their legs. We always see patients who are enjoying walking, treadmill, bike riding, but patients aren't doing a lot of arm exercise. I have some patients who enjoy splitting wood or cutting wood or sawing wood. But most exercise is not done with the arms. So we have patients who are going out and doing an exercise that they're not conditioned for, even if they're conditioned in other things. So if you're a well-fit athlete with your legs, but then you try to do something with your arms that you're not fit for, it can be really strenuous. So that's one reason why snow shoveling is more hazardous than we would expect. Another thing is that we're already in the cold. And I mentioned earlier that when we constrict our blood vessels, our blood pressure rises. So when you go out in the cold, your blood pressure rises. So it means your heart is already under stress. Then we're adding the stress of the arm exercise, which we're not conditioned for, and this is very heavy work. So that's another big contributor to why this is more hazardous than other physical activities. And of course, I mentioned that if someone's fit from a leg exercise standpoint, they still are at risk because they may not be fit from an arm exercise standpoint. But let's be honest, many patients aren't fit at all.
Sure.
They're not doing any activity. They're couch potatoes, and then they go out and they try to attack a 2-foot storm and do the whole driveway. So that's another issue. And we always tell our patients, we'd love you to exercise, but we say don't go out and try to run a marathon the first day. Right. Build up. And the problem is that, you know, the snow comes and all of a sudden you can't build it up.
Is there anything that you've come across, I've heard this before, that it's thought that something with the sudden exercise or the extreme exertion of snow shoveling causes, you know, a quote-unquote adrenaline surge that can then render the plaque in your coronary arteries unstable and lead to plaque rupture. And I've heard that postulated as a theory as to why people have heart attacks while shoveling snow. Anything about that?
Yeah, I don't have anything. No. I mean, I have heard something that I thought you were going to say is that one way that people actually shovel snow is they bear down, which is another way so that when you take a breath and you bear down, and that bearing down is something that adds stress to the heart. So your blood pressure is elevated from the cold, elevated from just doing the work of snow shoveling, and then it gets elevated further by this bearing down, so it adds all this stress. Sure. So all of these things I think may contribute. I think that the other thing is that, you know, the sudden, you know, you have to get to work, you got to clear the driveway. Sure. We don't warm up, so, you know, all muscles aren't warmed up, so we actually are at greater risk because we haven't warmed up. I mean, even weekend warriors who play a little soccer or touch football spend a few minutes warming up. They stretch their legs. Even people play golf or tennis, they spend a minute or two warming up to try to get their muscles warm. People don't do that with snow shoveling, and they should as another strategy. And one other thing is that smokers are at high risk. So people who are smoking at the time of shoveling snow are another contributor to this constriction of arteries. So all of these things, I think, contribute to make it more hazardous.
So there, you know, as much as I would love to have all of our heart patients not shovel, reality is that people are going to have to shovel sometimes. So maybe you could review with us some tips on how one can do it safely and properly, and then to really minimize their risk. So
there's a variety of things that, you know, we should talk about. One is to try to choose an appropriate length shovel. So just for the prop, we have the shovel here. And the idea is to choose a shovel that is of appropriate length so that you can bend your knees and get down on the snow and lift it by not bending over. So that's one strategy. And this is not just for heart health, but of course for back and other kinds of issues. So that's one idea. A second thing is, like this shovel, is to use a shovel that has a plastic, made of plastic. Number one, it's lighter, so we're lifting less from the shovel itself, but also the snow will slide off of it, won't stick to it as often. And a third simple strategy that you can use is by applying some lubricant. Our producer, Bob McConaughey, favors PAM. Some people on the web have recommended olive oil. Some people recommend a silicone like WD-40. But any of these lubricants just make the shovel slide into the snow a little bit easier and make it easier to fall off. So those are some simple strategies that you can do from the shovel standpoint.
How about I see all these bent shovels. Does that help the back quite a bit? Or?
Yes, I think bent shovels make a big difference because obviously you're able to stand more upright than having to get way down. And then this shovel, as you can see, has this cup in it that allows you to push. So that it's always preferred to be able to push rather than have to lift up and throw. So any shovel that allows you to push on a opportunity where you may have a 2 or 3 inch snowstorm and you can just push the snow rather than lift it is clearly a preferred approach.
Sure. Now, with regards to the heart, what else can be done to minimize risk?
Well, of course, the strategy that we talked about that puts you at risk, being cold, dressing warmly, dressing in layers that allow you, as you warm up, to take off some clothes, because as we warm up, we'll actually get wet. You mentioned that you get sweaty and you get wet. So if you get wet, then you're going to get cold. So dressing in layers that allow you to take layers off is a very important thing. So keeping hands and your body covered is really important. on some of those winter mornings when there's a lot of wind, recognizing the wind chill factor and covering our face with a scarf or hats is really important. Staying well hydrated, of course, is really important as well. This is another strategy. As you mentioned, the sweat, we lose fluids, we can become at risk from being poorly hydrated. For a lot of our patients, of course, pacing yourself. Again, people are waking up and they didn't expect a snowstorm and they got to clear the driveway and get to work. That's a problem. But for those of people who aren't in that circumstance, knocking off a little bit, take a break, go in, take a break, get some refreshment, and come back and hitting it again is a good strategy.
Are there certain cardiac conditions or patients in whom you would say absolutely not, no shoveling allowed?
Yeah, I think that's great, and I'm glad you remind me of that, because these are recommendations for safety, but there are people who shouldn't shovel at all. And my current recommendation is that in the first year after a heart attack, patients should absolutely not shovel. They shouldn't touch it at all. They shouldn't even do a light sweeping or anything, because I think my fear is that you do a little light sweeping, pretty soon the shovel's in your hand, and then you're doing more and more. So for that first year, you shouldn't. If I think after a year you're doing well, maybe you've had a repeat stress test, you're performing at a good level, you've been exercising, then going back to a prudent level of shoveling snow is probably reasonable. But again, this is where the devil's in the detail. If someone has a double wide driveway, then probably shoveling that whole driveway is not sensible. A snowblower is probably a preferred alternative.
Now, there's certain issues with patients who have congestive heart failure or valvular heart problems. Those types of patients too, should they not be?
I think that a patient who has a particular valve problem that we've talked about here before, aortic stenosis, definitely shouldn't be shoveling snow. Those patients would be at great risk. Yeah. Many of those patients are older and probably aren't shoveling snow anyways, but yes, definitely. I think a patient with congestive heart failure, again, the devil's in the detail. If someone is very short of breath with mild to moderate activity, yes, clearly. But if they're functioning at a very high level and they can pace themselves, they probably can do it.
Good, okay.
I mean, I guess, sort of the legal caveat disclaimer for this program, I would say that none of these are recommendations. These are just general guidances that patients should take up with their physician to have a really meaningful discussion about what's appropriate.
No, I agree. It's a big issue right now with this time of year coming around.
But I will say that many of my patients who I've seen who have shoveled snow and had trouble did have some early warning signs during the shoveling of snow. And they were 3/4 done and they said, well, let me just finish it up. And I think a lot of those patients would have done better had they just stopped and taken a break. So one really strong recommendation I do want to make is that if you're developing some pressure, tightness, heaviness, shortness of breath, nausea, inappropriate sweatiness, dizziness, feeling like your heart is palpitating, any of these symptoms, please stop, call 911, get evaluated, and the snow will be there when you come back. So I guess that would be a really strong recommendation I would make for the cardiac safety aspects of shoveling snow.
Good. There's still quite a few other winter topics to talk about. Maybe I'll defer to you what you want to talk about. There's things such as seasonal affective disorder. You mentioned carbon monoxide poisoning, frostbite, or seasonal weight gain. What do you want to go to next?
Well, I guess I would say that there's a fair amount of data on the topic of blood pressure in winter. Blood pressure seems to rise in wintertime. There's a variety of potential contributors to this. Blood pressure in wintertime may rise for the thing that we all know happens. Around the winter and the holidays, we all eat a little bit more, we gain a little bit weight, and weight certainly has a correlation with blood pressure. So that may be it. But one interesting link that some people are suspicious may be playing a role in it is vitamin D. And vitamin D deficiency is something that we've begun to really embrace as something that's more prevalent, more out there than we really realized before. We're recognizing that a vitamin D level less than 30 is something quite common in our patients. I saw it yesterday, a really pretty severe level of vitamin D deficiency in a relatively young patient in his 40s. He's concerned about skin cancer and actively avoids the sun, and it's another example of how sometimes doing one good thing can cause an unexpected another thing, and that's this whole concern about skin cancer and covering ourselves up with protective skin for UV protection has had this other consequence of potential vitamin D deficiency. So vitamin D deficiency is something that is real in the wintertime. Even if someone is outdoors, they're not getting much skin exposure where our skin makes vitamin D. So vitamin D deficiency seems to have a significant link. So I would say that patients who are concerned about this or have issues that think they may be avoiding sun, to bring that topic up with their doctor to have their vitamin D level checked. At this point, there's no recommendation that people should just take vitamin D. We think that's not a good idea. The Institute of Medicine, the United States-based governmental agency that has a group of leading physicians that come up with recommendations, has said that really the vast majority of Americans get enough vitamin D. That may be the case, but a lot of patients don't, in my experience. I would say at least a third of my patients have vitamin D levels that are less than an ideal level. So vitamin D is, I think, a contributor to it, and it may have some impact on these other issues. This whole topic of seasonal affective disorder, this concept of people who feel lousy, maybe have a depression during winter months, maybe related to light. It's a very controversial topic because in places that get very little light, like Siberia and Iceland, sees very little of this problem. So it may not be just related to light. It may be a cultural thing or some other thing that's hard to
I've
discern.
often wondered whether it's just more of an issue of people don't socialize as much. In my neighborhood, we actually all comment on it, how in the summertime, everyone's outside chatting, this, that, the other thing. But when the winter comes, everyone sort of retreats into indoors, and a touch more effort needs to be made to interact, and the socialization seems to go down a little bit. So I'm sure that contributes to some degree as well.
I think so.
For some people. So, we have just a couple minutes left, so maybe we can rapid fire hit through some other topics.
Well, I think we talked, just to mention, we talked about flu, we talked about decongestants, we talked about snow shoveling, we talked about blood pressure, weight gain in winter months, and the importance of trying to keep up with good nutrition in the winter months. I mean, we get into this habit of comfort food, staying inside, eating, foods that just make us feel better because we're inside. But trying to keep up a strategy of exercise. Many of my patients do a great job of going out every night after dinner. Sometimes husbands and wives walk together after dinner, but then in winter months they give it up. And in making a really conscious effort of going to one of these indoor malls, or walking somewhere, or walking the hallways of a big box store, or some strategy of keeping up exercise is really an important strategy to keep up health. And then there are some other things I mentioned which I would ask people to think about, and that's keeping warm with hypothermia as a risk. I mentioned the issue of carbon monoxide poisoning as a sort of a safety issue for keeping furnaces in good condition. And then, as you mentioned, just general mental health, seasonal affective disorder, and keeping good connections with family and friends.
Great. All right. Well, we just went through a lot. You summarized it all there at the end very nicely, but we are running out of time. So with that, I want to thank Dr. Seth Bilazarian for joining us for another edition of Matters of the Heart. This was brought to you by Pentucket Medical Cardiology as well as Haverhill Community Television. Thank you.